to Patient Perspectives, where we are privileged to hear a very brave and inspiring woman's journey with ovarian cancer. My name is Paula Anastasia. I'm an advanced practice nurse at UCLA, and I will be your moderator for today's program. I am joined by one of my patients, full disclosure, although sadly I had to share her with another provider as she lives in different cities at different times. But it is my pleasure to introduce Kathy as she shares with us her story and her journey with ovarian cancer. So Kathy, welcome and thank you for doing this. This is I'm very proud of you for being courageous and sharing this, because sometimes it can be private and open up vulnerabilities. But if you would just start with who you are and how old you are and where you live and that sort of thing. And then how were you diagnosed? We know that most ovarian cancer is diagnosed in the advanced stages because there's really not a lot of early signs and symptoms. So I'm gonna let you continue speaking and sharing with us.
Well, thanks for the opportunity to do this. I really appreciate it. And if there's any way that I can help others to get through this a little easier than I did, I'm all for it. So I'm 62. When I was diagnosed, I was 60. So it's been 2 years almost to the day that my diagnosis happened. I have a wonderful husband. I have 5 kids. I have 3 grandkids. And I have a wonderful French bulldog named Sophie. So that's what my personal situation is. And as Paula mentioned, I had been diagnosed 2 years ago, and I wasn't prepared for this at all. I had lived a very charmed life, very good health, very good insurance. I religiously had annual physicals. And my diagnosis came because I was just feeling bloated, and we were going through a move at the time, and I thought I just had a irritable bowel or something, and I was diagnosed 5 days after going to a doctor for what I thought was just going to be a gastro problem. So it was quite shocking for me.
How long were you experiencing the bloating before you sought medical advice or intervention?
It was only a couple weeks. And again, I didn't have really good gastro systems my entire life. So it really didn't distress me. But when it kept getting worse, not better, that concerned me. And the second thing was my appetite was a bit suppressed, yet I was gaining weight. And as I say, I pride myself on trying to be fit and athletic. And so it was just a peculiar triangle of things that were happening that didn't make any sense. So it was really only 2 weeks that I had really symptoms that I felt there wasn't something right here.
And I love that you pay attention to your body, because that's one of the things we're trying to educate primary care physicians and gynecologists, because they're going to be the ones to maybe see ladies who have these symptoms and not dismissing them. Like, oh, it's just something you ate. But like you said, I'm gaining weight, but I'm not eating. I'm feeling full. Right. So after you saw the doctor, did they order scans?
Yes. So it's exactly as you said. I went to my general practitioner on a Monday afternoon, and she was confident it was just some kind of blockage. I shouldn't be concerned. This, 2 weeks into this, there really can't be anything. And then by the time we got to Wednesday, they were a little more concerned, because a typical just standard MRI or ultrasound was showing nothing, which is also interesting, because I had no tumor that was large enough that could have been picked up by a routine scan. And it's only when I went in to have a fluid tap and they took the fluid out of my belly that they actually did the diagnosis. And that happened on Friday of the Monday I went in. So I am really, really fortunate, because I understand many people, they'll have these symptoms, which are not really arduous, but people will say, well, you're just experiencing stress right now, come back in a couple weeks. But I had a very diligent diagnosis team that within 5 days, they said, you're right, something's not going the way it should right now.
And when you said you had the fluid drain, so did they find that on the ultrasound or the MRI?
No, I actually went in, and I'm going to get this wrong, but a
Nobody can fact check you.
So it's a paracentesis.
Paracentesis, correct. They put the needle in your belly and take out the fluid.
And they took out the fluid. The great thing about it is I lost 10 pounds in less than a half hour.
Do you remember how much they took out? Because you weren't under our care, you were in another state.
This was just a diagnosis at this point. They took out 10 pounds of fluid.
They took out 3 liters.
Yes.
Yeah, and you're a little bitty thing. So your belly must have been really distended.
Well, yeah, it was very unusual for me.
Yeah. And how fast did your belly, because I know you have a, flat, fit belly. How long did you notice that change from the bloating to the distension? How long a period of time did that occur?
It was only a week.
Wow.
Okay. The symptoms were there the first week, and the second week I could definitely feel the bloating.
So you had the paracentesis, they get the diagnosis on cytology, not on tissue, and they tell you what?
That you had to wait a couple more days for them to actually get some confirmation of what it was, and that was when they detected ovarian cancer. And then I was just, again, at general practitioner level, that I went and saw the first oncologist. And that's when my head exploded. You were 24 hours into hearing the cancer word, and then the next thing you know, they're wanting you to sign forms to start chemotherapy in 10 days. And I just had to stop. I just said, this is not anything that I'm prepared to be signing any forms for what this is. So I just said, well, thank you for the information, and I'm going to go away and take some time and learn more about this. I didn't know anything about ovarian cancer. So, that's the one thing I would tell people is the doctor that you see, I'm sure, is very talented, but you need to make sure you do your diligence, and because there's so many different ways and there's so many different opinions. Stop before you decide to do anything and get comfortable that you really understand what's going on and what your treatment program is going to be.
And when you saw the first oncologist, you said the word oncologist, were you referred to an oncologist who does chemotherapy, or were you referred to a surgeon?
No, I was originally to an oncologist. Then I did more diligence, and that's where I ran into you. As well as Dr. Carlin. And then I actually phoned many friends that were just general practitioners and got referrals. I spoke to 5 different oncologists and surgeons before I really decided what to do. And then I ended up with my surgeon as well as Dr. Carlin at oncology.
So kind of what I'm getting at is, like you mentioned, there's 2 ways to treat ovarian cancer. You can give chemotherapy, surgery, chemotherapy, or you can do surgery up front, followed by the chemotherapy.
Right.
When did they present, we need to do surgery, either before, middle?
The original person that diagnosed me was very much in the vein of do the chemotherapy for 3 sessions, then do the debulking, and then do more chemotherapy. I don't know why I was so uncomfortable about that, but the surgeon that I spoke to, he felt very strongly that let's go in and let me take a look. So they did a probing. Because he wanted to, his feeling was if it isn't at real advanced stages, since there was no major tumor, let's go see if I can get it all. Because his concern was if you do the chemotherapy first, it might shrink, but you may not actually see it all and get it all. And it all made sense to me. And with all due respect, when you hear you have cancer in your body, the thought of getting it out as fast as you can is really emotionally appealing. And I'll be honest with you, the thing that I underestimated the most was the actual debulking surgery. It was 7 hours long. And in hindsight, what I knew about when I learned how I would feel after 3 rounds of chemotherapy, if I would have had to gone in for surgery after 3 rounds of chemotherapy, I would not have recovered as quickly as I had. I think I made a really good choice for me. That's not to say it's for everyone else.
So you did the surgery first and then the chemo.
I did.
Okay. And then was the discussion of genetics, did that ever come about?
Yes, they actually did that after the surgery. And it was interesting because they used 2, what I guess, biopsies. They used surgery biopsies as well as my parenthesis biopsies from the fluid to also detect what potentially was the cause of the cancer. And I know it sounds really peculiar, but when it comes back that you're BRCA positive, it actually was a relief to me, because at least I knew what it was, and I knew that there was a lot of research being done on PARP inhibitors. And I actually would have been disappointed if I wasn't positive.
So they did the test on the germline testing. Okay,
well,
so
whatever you guys call it.
no, because they're germline. So we either draw your blood or we get a saliva sample.
Okay.
And that's standard for all women with ovarian cancer. And we want to see if you have a hereditary predisposition. And then we can also test the tumor. So given that you have a hereditary, meaning it's, it was inherited, if it was positive on the tumor, that would not be passed down to any children. So given that it's a hereditary, how did you go about disclosing or talking to the kids about that?
Well, we had a long discussion about it, and I think age has a lot to do with it. I was more concerned about my nieces and nephews who are at child rearing ages, right? So they all went and got tested. They all wanted to know, and believe it or not, every one of them was negative. Wow. I guess I'm really lucky.
And all your children
are positive.
And your kids are negative.
Yes.
Yes, that's great news. And then were any male relatives tested?
Yes, both my brothers as well, and they are negative.
Okay, and was there any resistance with the men not wanting to get tested?
No, everyone, nice. We're a data-driven family. That's so nice. Everybody wanted to have as much knowledge as they could.
And that's important. Some men think, well, I'm not going to get ovarian cancer. I don't need to be tested, but they can get other cancers related to it. And speaking of that, I don't want to spend a lot of time on this, but did any of us or your other physicians, nurses, talk to you about other risks besides ovarian cancer related to the BRCA mutation? Well,
certainly breast cancer came up, but I always like to tackle the immediate problem first. So we've had conversations about that now that we're 2 years into this journey, but it's, if you don't get over the first hurdle, it really doesn't matter what the second hurdle looks like, in my opinion. So we poured all our energy into the ovarian cancer.
But you are doing screening for breast cancer, correct?
I am. Right. So once we finish the chemo and I went on the PARP inhibitor, I do an MRI every year and alternate 6 months with a mammogram.
Right. So you are being proactive.
I am.
You are doing something. So tell me about the chemotherapy experience. You had 6 cycles of carboplatin and paclitaxel.
Yes.
Tell us what we, in hindsight, whether we did a good job of educating you or, afterwards, I think even myself, those delayed or long-term side effects. Right. Tell me about what you went through, and then if there's any residual and what we can do better as providers.
I think the thing I didn't understand that would get progressively more difficult. With the first chemotherapy, you hear all the stories about the nausea and all that. And compared to what my expectations were, the first chemo was, I would say, relatively easy, believe it or not. And, a little bit of sleep the next day and I was feeling pretty good. But I didn't really have an appreciation that when you get to rounds 3, 4, 5, and 6, you're compromised, right, going into it, and it's much more difficult. You have a lot more fatigue. I think fatigue was, and I've never experienced true fatigue. You know, I've been sore, I've been tired, but fatigue where your entire body just is out for the count. That was my biggest symptom. The meds on the nausea worked great for me. And you're going to ask me what they were, but I don't remember. Okay. But whatever that nausea cocktail is worked great for me. I really didn't have any vomiting. And a little bit of nausea, but take a pill and it would go. But it was that chronic fatigue. And then more on the long-term neuropathy. And really the neuropathy for me didn't kick in until late, probably just in the last cycle of 6. I didn't have any neuropathy. I still suffer with a neuropathy today, but I've learned how to live with it. I'm not debilitated. I also ride my horse still, and I find a way to do all the things that I did before my diagnosis.
And have you made any adjustments in order to be able to do that? Whether it's emotionally, physically, taking medications or supplements, or just pushing through?
I don't know if it's just a result of the entire chemotherapy or age or the PARP inhibitor, but there is this element that you need to allow yourself every day a half hour to lay down. And I can tell you, I don't know why it is, but I used to go 12, 15, 18 hours without hardly sitting down, but there is this remnant of fatigue that is easily remedied by just spending a half hour off your feet and relaxing. And it took me a while to figure that out before I said, if you just gave yourself a break in the middle of the day, everything would be good.
Yeah, a little power rest or power. And did you do that after your chemotherapy was done, or did you do that while?
Well, when
did you learn that?
I didn't learn that till about 6 weeks ago. Unfortunately.
Oh, good.
I'm feeling much better now.
Excellent.
I didn't give myself a break. I kept thinking it was one of those things that I would get over, but after 2 years, I decided maybe you better put that into your routine.
I love it. Okay, so you finished the 6 cycles of chemotherapy, and then how did you learn about this medicine, this class of drug called PARP inhibitors?
Well,
did we tell you, somebody tell you?
No, you guys told us, and it's very fortuitous because it was FDA approved in the middle of my chemotherapy, so that was like a little bonus check for me. Mm-hmm. And it's new, right? So people don't really know what the long-term prognosis is because it hasn't been around, but it's something that gives me a little bit of satisfaction that there's something out there that's working for me on a daily basis that's trying to make me better. So I think it's awesome.
So you're on Lynparza or olaparib,
yes,
whatever word you choose, whichever name you choose. And that was FDA approved for maintenance therapy after primary chemotherapy. So you're right, that was the first one on the market, but it's been approved for other things, for after somebody recurs, not you, and then they get into remission, or somebody that has recurred numerous times, and then this is their 4th line treatment. But right. It's so wonderful, like you said, what a blessing that it was FDA approved during your experience. And then what is the goal to be on this medicine? Do you know that?
Well, certainly it's supposed to repair the genetic formula that caused all this. And
it doesn't have to be scientific.
to
prevent or delay a recurrence. That's where I was going. Yeah.
And the thought is it would be a 2-year protocol. And we'll reassess that when the 2 years next spring comes around as to what other data has come in, whether there's a change in that thinking or if that's what we'll do.
And was there any hesitation when Dr. Carlin recommended to, you finish chemotherapy, it's like, oh my gosh, I'm just finally not maybe going to be as tired, although you can tell us how tired you continued to be. But did it ever occur to you that, oh no, I'm just like done?
Oh no, there was no discussion. Again, given the fact that the bulk of these are late stage, you need to go do everything you can aggressively to treat it. So there was no discussion. It was just, when can we start?
Okay. And then what were you told about side effects?
They are certainly fatigue. Again, I'd say the first probably 8 weeks, I struggled with a bit of nausea when I would take them. The regime was 2 in the morning and 2 at night. The nighttime didn't bother me at all. The morning, because I am very active in the morning, it would take me out for a good hour after I took them, and I tried it with food, without food. Really, the outcome wasn't that different. So then we agreed we'd go to 1 pill in the morning, and either my body got really used to it or that was the magic formula to get it done. But it doesn't really matter if I've eaten or not eaten. I take it religiously at the same time, have my alarm clock set twice a day, and take my pills religiously. And I say again, I don't know if it's just because of the journey that I've been through, or maybe I'm getting a little older, or maybe it's the pills, but a half hour a day of downtime isn't a bad thing.
And I know you said that you just learned to do these little power rests about 6 weeks ago, but when you were first taking the olaparib, did you need, or did you take naps or rest periods during those first several months?
I did, and I wasn't nearly as active, and that's after doing a major surgery, which most people say take a year for you to get over, and then the regime of chemo. You add on top of that a medication that you're unfamiliar with. You're not really sure what's driving the symptoms. But they did get much better, and I would say a real inflection point was about 6 months on the drug, which would have been corresponded with a year after my first surgery. I felt much more like myself, but you need to give yourself time for that 6 months after chemotherapy, and that might coincidentally go with a year after surgery. That those are big things to undertake in your body to handle. So give yourself time.
Was there, so I want to talk about the emotional side of it, but just when you started, what was the protocol for blood tests? I know we do a little bit different.
I recall we were on weekly through chemotherapy, and then I think we stayed on weekly for a little bit, and then we went to monthly on the Lynparza, and then we are now every 3 months.
Right. I like how you posed it as a question. Am I answering this correctly? Yeah. So the package insert of the FDA approval is we should be monitoring women who start the olaparib monthly, because you can have anemia, low blood counts. But because Dr. Carl and I have had so much experience, and you did not live close by, we said, you know what? We're going to do this weekly because we want to see if there's any changes. And that's also a double check that you and I are going to communicate, because you're like, I did my labs, what are the results? Or I'll say, did you do your labs? And so it was kind of like a double check guarantee that we are at least going to communicate weekly. And we did, and your blood count stayed fabulous. Her hemoglobin was 12 to 13. I think it's higher than mine. But you did experience that fatigue, like you mentioned, around the 8th week. And then we were doing labs monthly. But the fatigue was actually interfering with your daily quality for you, that you weren't enjoying your life as much as you wanted to be because of fatigue. And I remember we had this conversation about, what is the data as far as dose reducing? Do we just hold it for a week and see what happens? And the decision was that we would dose reduce, knowing that one size does not fit all. And we really listened to how active you are, and you're traveling and you're riding your horse and you've got your family and you're doing so many things. And it's like, oh my gosh, we want you to live, but we want you to live well. So as you said, you're taking 2 pills in the morning and 2 in the evening. Again, per the FDA guidelines, are supposed to dose reduce you by 50 milligrams. And that would have been another order of a different dosing. And sometimes we just get lazy and we just, let's just keep it simple. Take 2 at night, sleep through any unpleasant side effects, which you had very little of, and then just take once in the morning. And that did seem to work for you, as you said. So I'm just kind of reinforcing, if anybody's hearing this, is like, you didn't really manage that the proper way. But again, we customized it to you in your lifestyle, and you've done very well. But I do want to hear about the emotional aspect, just chemo, that 1-year milestone, just kind of relapse of like, oh my gosh, what have I gone through? When did that hit you?
Really, you get better with time, as I'm sure all cancer patients do, that there's not this gnawing thought in the back of your head that, oh my God, this is imminent and it's not going to be good. So I don't have it daily, but I still have what I name scanxiety. Is what, I know when that 3-month mark is coming up and I need to do the blood tests, and the CA-125 was a big marker for me. So there's something very reassuring once I get my blood test and everything seems to be good. But the other thing I do know is that if you are really in touch with your body, I can tell you when my counts are even 10% below normal. And there's just days that I know that I pushed it too hard and I need to chill out for a couple of days and read my magazines, and then I feel better. So I just, the emotional part of it is just be in tune with your body and be sure that you listen to it and you do what's right for your brain, because your body's trying to tell you something.
That's good advice. And who worries more, your husband and your kids or you, as far as how well you're doing?
Well, I don't know, this might be a bit cavalier, but I think that person that actually has the cancer has the easiest job. Because you know, to the extent.
I know what you're saying, but what you're going through is never easy. But I know that you have this loving family and they worry and they're going through it as well.
They are. They're actually, I think, going through it more than I am. Because there's, when you live it and you experience, you do everything that you can, and those around you love you, but they don't want to be too intrusive or too pushy or not interested. So there's a very delicate balance, and I appreciate when people just ask me how I'm feeling. It's just that simple question. How are you feeling? And that gives me the opportunity to go into any level of detail I want in answering the question. And I appreciate that they care enough to ask the question.
That's lovely. What advice could you give us, me, caregivers, nurses, on what we could do? And that was helpful. How are you doing? What we can do better in our education, in our compassion, our care.
Right.
I know that you appreciate us. I'm not looking for that. I'm looking for what we can do that would, maybe it could have been a little bit better.
Well, you were extraordinary, so I'll just say that. But most importantly was the accessibility, because especially early on, or when you're going through the chemo, you just don't know what you don't know. And you don't know that something that you experience is common. And then what happens if you don't have someone to say, no, you're okay, that's expected. You warp yourself up emotionally even more, which is not good for your body. So the accessibility, and I know it's not very fun for you guys to be accessible 24/7, but just that one-liner that says, no, you're okay, let's talk next week. That one-liner that is within 4 or 5 hours of when you send it is just insurmountable in how much it helps settle you down. And then I think after this journey, the hard lifting with the surgery and the chemotherapy is try to get back to your old life. when you live your life as you plan to live it versus a cancer survivor, that's the real reward. So you and Dr. Carlin were very frank with me to say is just go live your life, right? And you just need somebody to tell you that you've done everything that you're supposed to do. You guys are on top of things I need to know. You're going to let me know if there's something else new that I need to know about, and just go live your life. Don't be out there researching on the web of what's next on ovarian cancer, because you have the right team with you. And so you should go live your life as a patient.
I think I'm just going to send all my patients to you. You can just be their coach. That is really, really good advice. So thank you for that. I really appreciate you sharing. Is there anything else that you think would be helpful, whether it be a coping tool for a patient that might, I think giving them permission to rest, giving them permission to say, okay, today's not such a good day, has been helpful?
Yeah, I just reiterate is just remember it's a big journey, and don't expect that you're going to be exactly the same as you were before the journey, but expect that you can still live a really, really good life with maybe a few inconveniences along the way. So that's my only words is, find the right team, listen to them, and be diligent.
Good advice. Thank you so much, Kathy. We really appreciate you being with us here today.
My pleasure.
Many more years.
I know you will. Thank you so much.
Thank you.